Welcome to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. With over 20 years of expertise as a mindset warrior, perspective shifter, and unshakable optimist, I am dedicated to helping you reach your wildest dreams in business, health, performance, and relationships. Learn about the power of thought and how it shapes your life to take risks, change careers, find love, go on adventures, and live passionately with me, Dr. Diane. Get ready for revolutionary ways of thinking, being, and creating an amazing life. The Dr. Diane Show starts now. Hello, everyone. I am Dr. Diane Hayden, and you are listening to the Dr. Diane Show on Transformation Talk Radio. Stay with us for the next hour, where we will explore revolutionary expansion of mind, body, and soul. Join me on the first and third Thursdays on the show, where I have experts from around the country teaching you cutting-edge therapies on longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. And please like and subscribe to my channel, Dr. Diane Hayden. I'm excited today to have with me Dr. Selinda Shepard. She is a doctor of physical therapy and specializes exclusively in pelvic health and has dedicated her career to helping those who have pelvic health issues find the relief they never thought they could. Dr. Shepard's goal is not to just get you by for a few days, but to get at the root of the issue and resolve it so you don't have to keep coming back. In addition to her advanced training in pelvic health, Dr. Shepard has specialty training in sexual medicine for pelvic health, oncology for pelvic health, acupressure for pelvic health, yoga for pelvic health, women's health certification, including pre- and post-pregnancy care, and functional nutrition for chronic pain. So welcome, Selinda. How are you today?
Good. Thank you so much for having me. Appreciate it.
Awesome. So we're going to get to probably the number one question, which is what exactly is the pelvic floor, which I'm sure listeners are like, yeah, I've heard about that, but I don't really understand it and all that stuff. But I wanted to ask you how you got so passionate about this. Like, was there something along your journey that kind of directed you into focusing, so specifically on this, and what makes you passionate about it?
So I think I've always been the type of person who's wanting to help like the underserved population. And I know that there's just not a lot of providers out there who treat this. And it's a really important concern that many women, are dealing with. And I was thinking about this, and it's really wild that it was so long ago, like in the 90s, when I was a physical therapy aide. So I've always had a passion for physical therapy, because obviously I've been working in it since the 90s.
Mhm.
But one of the therapists asked me if I would be interested in helping her in women's health. And I was like, sure, I'm always up to learning more. And that's where it all first started. And then in my doctorate work, I took a elective in pelvic health, and I was like, ooh, this is very interesting. And then proceeded to take more courses starting in 2011. And I feel like I'm a lifelong learner, so I'm always taking courses. And yeah, it's just one of those things that I feel like there's not enough people out there who are treating this. And I also want to encourage women to be advocates for themselves, to try to get the care that they need. So it's definitely a passion of mine, and I'm happy to be here.
I love it. I love that. Yeah. I mean, honestly, I think for the majority of us, we've heard the terms, pelvic health, pelvic floor, but what exactly is it, and why is it so important?
Yeah. So if you think about, like, let's say this is like your pelvis. Okay. So that it kind of makes sense. So that's the pelvis. And then it can create like this basin. So this would be like the floor, kind of creating a hammock. And those are the muscles, and they form like a group together, and they support your organs, your bladder, your uterus, like your rectum, and your core. And so they're so important because they have to deal with your bowel and bladder function, your sexual function, your stability, breathing. So they're really helpful. And pelvic floor helps in making sure all that's, working properly.
So is it the muscle group? Like, is it part of the abdomen, let's say, like lower abdominal muscle group, and also like hip flexors and everything around that area?
So when you engage like your deep abdominal muscles, your transverse abdominis muscles, so those like co-contract with the pelvic floor. So that's like my favorite exercise to give to back patients, pelvic patients, because I think that one of the number one things that can happen is not knowing if you're doing the exercise correctly. So I always give a very, safe exercise to do, and that is one of the deep core muscles, the transverse abdominis, and that co-contracts the pelvic floor. So I know we're going to always be like kind of indirectly getting to those muscles, and you're not going to be doing anything that you shouldn't be.
Yeah, exactly. Interesting that you mentioned like with lower back pain and that kind of thing, because I know a lot of women, and I think this is primarily because nowadays we sit so much, right? That have so much lower back pain. And it's not like they're doing any kind of, extreme heavy lifting, and they don't have physically demanding jobs. But I feel like it's because all that muscle group and the hip flexors and everything is getting so tight just from sitting all the time.
Yes, yeah, so definitely. And then, like I was showing you here, like this is like the pelvis, right? So there's that pubic symphysis. The muscles come from the front to the back. So if you're, a lot of times I try to release the muscles on the inside, like your adductors, because those are, the muscles that can get super tight. Your muscles on the outside of your hip, sometimes I'll take like a ball and roll on the outside to release them because you're sitting a lot, you're flexing them a lot. And so we need to elongate those and release those muscles. So absolutely, that is, part of the reason they're becoming, too tight from sitting and wanting to need them to stretch out and move around a little bit more.
Yeah, and I think a lot of women think that, or the misconception is that you really only need pelvic floor therapy if you've had children, right? But really, it's for everybody.
Absolutely. I know everyone automatically thinks, oh, okay, you had a baby, so that's where you're going. Well, actually, you can be an athlete, you can be someone with like constipation, someone who's had a surgery, um, any sort of menopause changes. There's lots of we talked about before, anything suffering from chronic hip or back pain, anything like that can really often, do well from pelvic floor PT. It's going to address it. It's going to help with any of those bowel, bladder, sexual function concerns. So yeah, it's for basically anyone with a pelvis that is looking to restore their function.
Yeah, it's so interesting. You mentioned constipation like that. That one is like new to me. So
Oh yeah.
it will help with people who have irregular bowel movements or suffer from constipation or something like that. That's so interesting.
Absolutely, because one of the functions of the pelvic floor is sphincteric control. So the sphincters have to open and close, and so if they're not like opening when they're supposed to, so things have to be coordinated. There's a lot of coordination going on with the pelvic floor, and there's lots of types of things we can do. A lot of education, things to help get things moving. But yeah, one of the functions is sphincteric control. So that's why constipation is one of the things that you'll see.
Wow, that's awesome. So explain to us what it is. Like, I think people are wondering, like, okay, I know that, I know the purpose, the area. So what happens when I come see you? Like, should I be nervous about this?
No, definitely don't be nervous. Honestly, it starts with a conversation. We're just trying to get to know your concerns, what's important to you, looking at your past medical history. I'll go over like your posture, your breathing, looking at your coordination, looking at your flexibility. We talked about all those hips, and I look at all your lower extremities, just seeing where there's any deficits that we need to address. A lot of people have some underlying like sacroiliac dysfunction problems, which basically means where your low back meets your SI joint or your sacrum. That can be something that can be a little bit involved as well. And what's nice is they kind of can get better at the same time that we're doing pelvic floor, which is such a bonus. And then with a patient's consent, of course, I'm asking, can we do an external exam, looking at the function of the muscles, looking for coordination, and then also internal exam, assessing any tightness, any sort of strength concerns, or any pain concerns. And with all of that, we come together and figure out what's going to be the best course for you. And really, a lot of times people find that they're empowered and they're comfortable in the session. So nothing to be worried about.
Yeah. How often do people typically come see you? And I know this is going to be based on individual, issues and things like that. But just generally speaking, how often do you see people? And typically, like, how long of a period would someone, do therapy with you?
Right. I would say like once or twice a week. And let's say you had a very straightforward, I don't want to say complicated, like non-complicated, concern. It's going to be like maybe, anywhere from 6 to 10 sessions. It depends on what all is involved. Because like I said, a lot of things can kind of overlap. You can have more than one concern. So it really depends. But on average, I would say, 6 to 10 sessions for like basically, urinary leakage, you should be able to manage after that.
Yeah, that's great. That's great.
Mhm.
So there's issues with the pelvic floor being too tight, but also too weak, right? And how would someone know like what is which way theirs might be?
Sure, sure. So if you're, too weak, you might have some symptoms like urinary leakage. You might feel like some sort of pressure or heaviness. You could be having difficulty, controlling gas, holding it back. Um, and so those are some of like part of the main ones you start to notice for any sort of weakness. In terms of being too tight, you might have, pain, trouble emptying your bowels or bladder, pain with intercourse. We talked again about hip and back pain. And really, an evaluation determines which one or which way it is too tight or too weak. But usually, like I said earlier, a lot of times there's a combination. It's not just one way or the other.
Oh, that's interesting. So you could have both.
Oh yes, yes, definitely. Yeah. And so I would say a lot of patients have, a mixture.
Yeah. Yeah. Do you treat men as well?
So I personally do not treat men,
Yeah.
but men, they have a pelvis, right?
Yeah,
And they have
that's why when you said that earlier, I was like,
like
oh,
anybody,
interesting. Yep.
anybody with a pelvis, so I said, can benefit from pelvic floor. So yes, men have pelvic floor as well, and they can get dysfunctions. And there are a lot of great therapists out there who do treat men, but I focus exclusively on women.
Right. Right. Which is great, I think. Obviously that specialty, the way that you have, designed your practice as a niche is really great. So you can focus in on exactly on what women specifically need.
Right, right, absolutely.
Yeah, that's awesome. I'm glad we're talking about this because honestly, like I said in the beginning, I know what the pelvic floor is, heard about it, had a general understanding, like what does it mean if it's weak, what the symptoms are, that kind of thing. But, like you said, one of the reasons why you got into this was because it's serving an underserved population. I think there's so many people that really have no idea how important this is, and that they can get help if they have a situation with it.
Absolutely, absolutely. And you're your best advocate,
Hmm.
and you know your body better than anybody. So I encourage if something doesn't feel right, definitely say something and just say, hey, what about pelvic floor? Can I try it? And but what's even better than you mentioning it to the doctor is called direct access. You don't actually need a referral to come see me. You can come into my clinic and I can treat you without a referral for up to 30 days or 6 visits, whichever comes first. And you need to be making progress, and if not, if there's any concerns, or I feel like you need to be referred to a provider, obviously I'm going to refer you to the provider. But it's great. So you have
Oh, that's
easy
awesome.
access to care.
Yeah, that is so awesome. Well, we're going to learn a lot more. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. When we come back, we'll explore more with Dr. Selinda Shepherd. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. But before we continue, I want to make sure everyone knows how to contact me. You can find me at either www.drdianehayden.com or either of my two publications, www.naturalnutmeg.com and www.essentialnaples.com. And you can learn more about Dr. Selinda Shepherd at her website, which is www.myptworksllc.com. That's spelled MYPT WORKSLLC.com. So, um, when we were just going to break, we were just talking about, how important it is for women, really anyone, to really understand, what the pelvic floor is, to know recognize their symptoms, to know if they might need therapy or treatment for a too weak floor or a too tight floor for sure. And I want to move into like, we talked about like just noticing different symptoms and things like that to kind of know which way or if you might need therapy. But there's other things related to different life transitions for women, like pregnancy, postpartum, menopause. So let's talk about a little bit about how you treat women going through all those different transitions, because I think maybe we discussed that it's not just for women who've had babies, it's for anyone, women who have never had, gone through childbirth, but also it's for different stages in a woman's life, right? Like people might think, oh, I would only need pelvic floor therapy if I'm older and maybe I have some, incontinence or things like that. But really, it's for a pretty like major time of your life. You could be in need of treatment, or it would be helpful for you to get therapy, right?
Yeah, absolutely. Absolutely, for sure. So, for going to the stages, if you're, let's say you're during pregnancy, what we do is we help with reducing pain. A lot of women, when they're pregnant, may have some sciatic pain. They might have some rib pain, or the pubic symphysis can start to, come apart a little bit. The abdominals, that's part of making room for the baby, the diastasis recti, all these things can be concerns. So we're trying to help during pregnancy, just with mobility, and really prepare the body, during pregnancy for, delivery. And
Mm-hmm.
then postpartum, we're looking at, helping to rebuild the core strength. I talked earlier about the diastasis recti, trying to help manage that and improving your bladder control, and addressing if there's any pain or pressure concerns, things like that in postpartum. And then menopause changes, there's a lot of hormonal changes, leads to like the tissue becoming thin and weakened. So you might have some symptoms like, urgency, some leakage, dryness, let's see, any discomfort like that. We would try to address that with pelvic floor therapy to help strengthen and really support you in your long-term pelvic health.
It's so interesting to me that it has such an effect on things that you wouldn't think when you think about, like, you know, the muscles and the bones of the body, let's say. I don't think it's natural, or at least for me, I'm not making the connection between how does, like, strengthening my muscles have anything to do with the inside in terms of like vaginal dryness or something like that. Like I would not normally make that connection at all.
Right, right. So the thing with vaginal dryness is there's a decrease in estrogen. So the estrogen is because there's a decrease in that, and the tissues weaken, so they become thin and not to sound scary, but they can, tear.
Hmm.
And so you're trying to help them navigate that pain. There's like creams you can use, there's, lubricants, and you're just trying to provide some supportive structure so things can, function better. And if there's pain, obviously we try to, release some muscles, things like that. But yeah, there's definitely, it's multifaceted.
Right, right. How old is the youngest patient that you've seen or have?
So usually I treat around 18 is usually the youngest that I treat. I don't treat pediatric
Mhm.
patients. And I think the oldest patient I've treated was like 90.
Wow. Yeah.
And I was so impressed with her. I was like, wow, she's doing her stuff. And, so it's your whole lifespan, that you can benefit. But yes, there are pediatric pelvic floor therapists. I just happen to not treat children. And it's totally different. It's different. It's not
Right.
the way you would go about treating them.
Yeah, and again, it's so interesting because I think the the conception is that, oh, it's only for women who are older that would need something like this. Or maybe, people who, women who've had multiple childbirths or things like that. But probably, you know, you're thinking of it from the perspective of, well, you'd only go do this if you're having like urinary leakage or something like that, and that's for like old women or women who've had multiple childbirths. But really, like we're saying, it's beneficial for a woman of any age.
Right. And you'd be surprised. Like I have some young, women who are like, oh, my whole life I've had problems since a child. So it just depends, whether it was, chronic constipation or they had, urinary leakage problems from a young child. So it just depends, really it's another reason would be like if you have an increase in abdominal pressure. That's probably like the main thing. Like increased pressure can be the reason why you have to think of a balloon. A balloon's, filling up with air and it has nowhere to go but down on those muscles. So over time, that pressure is, making those muscles become a little too stressed. So if they're not, able to support you, you have to try to, work on those.
Yeah, so it really does have a big connection to the GI tract, basically, like your whole gastrointestinal area, and people who probably also suffer from, things like
Idea.
just, yeah,
Yeah.
exactly. Like anything that's going to cause a lot of bloating or gas or something like that can have this effect on the pelvic floor.
Yeah. And you know who else is another group of um, women is teachers. They are notorious for having problems because they don't have the breaks that
Ah,
they should. So they're holding urine too long or they're pushing to hurry up and go to the bathroom, So all these things are not great for your pelvic
yeah,
floor. So yeah, it just depends.
yeah, yeah. Um, I think we touched on this, but I just, because I know there's so many women that struggle with low back pain, I just wanted to kind of review that again. So obviously, pelvic floor therapy can help with low back pain, hip pain, things that are not necessarily related, or you would think are related to the structure of the pelvic floor.
Right. Yeah, a lot of times, so unresolved back pain. And it's like, oh my God, it was probably the pelvic floor because the pelvic floor, it's like your deep core. And so if you can start addressing that, then usually you'll start to feel better reducing that hip and back pain. So it definitely can help.
And when someone comes to see you, what's typical session look like as far as like, am I doing different exercises? Are you doing more manipulation, or is it kind of a combination of everything?
Yeah. So a lot of it's, especially in the beginning, is education, trying to, let's say you're seeing me for urinary leakage. I'm going to definitely want to have you do like a log, uh, which is where you're logging in, when you're, it's interesting because you're going to log in, when am I being,
Right.
and how long am I being for, and so you're being like super aware of what you're doing, like how much did I drink that day and did I leak, and so but all that gives so much information so we can analyze it and look at, are these trends normal, are they not, and do I need to make some modifications, so a lot of it's education, and then there's definitely, exercises that are tailored to your needs, and then manual therapy as well, and if needed, some modalities, but usually that's what the sessions encompass.
And I imagine you're teaching people things that they can then take and do on their own, right? I mean, this is
Oh,
an ongoing thing. It's not like I'm gonna go to therapy with you, and then when we're done, I don't have to do anything.
oh, yes, there's homework.
Yeah.
And you will be tested. No, just kidding. No, but you actually are being tested,
Yeah.
but you got to do it consistently. And I like to review it and go over it because, maybe just hearing it a different way the next time is kind of like, oh, the light bulb goes off. Okay, yeah, that is what I was missing. And it's important that you have someone guiding you, along the way to make sure you're doing things properly because you don't want to be doing them incorrectly and then kind of working against yourself, you know.
Right, exactly. But even after, someone has seen you for, say, like you said, average 6, 10 sessions, maybe it's longer than that. You're going to want them to be doing things on
Oh
their
yeah.
own. Yeah.
Yes, yes. You know, hate to say it, but it's kind of like it's like part of your maintenance program, right? You're gonna, like, if you work out, a few times a week, you're gonna throw a few of these things in there, just to make sure that you're maintaining, because they're muscles. So the
Mhm.
muscles need to be addressed, just like anything else. If you haven't worked out your biceps or triceps, they're not going to be that great to help you lift stuff.
Mhm.
So it's the same thing. You got to kind of consistently work on them for them to be there and support you when you need it. And obviously they're supposed to be turning on when they need to turn on, but we need to bring some awareness to them as well.
Right. Exactly. Well, it's a lifestyle, right? I mean, when I tell people who have had to, start exercising or they start lifting weight or whatever it is, it's like, or if you eat differently, it's like, don't think of this like, oh, I'm just going to do this for this amount of time. This is like my biggest pet peeve with weight loss, right? Like everybody thinks, well, I'm going to make all these changes, but I'm only going to have to do it until I lose the weight. Then I can go back to doing what I was doing before. Well, what do you think
Right.
is going to happen if you go back to doing what you were doing before? Or basically, which is probably nothing. So not doing anything. I mean, then everything reverts back, right?
Yeah.
So, you got to look at it like it's a lifestyle. So this is fascinating. We're going to get into a lot more with Dr. Shepard. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. When we come back, we'll be talking more about the pelvic floor, and stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden, and I'm talking today with Dr. Selinda Shepard. She is a pelvic floor physical therapy specialist, and you can learn more about her at her website, which is www.myptworksllc.com. That's spelled MYPTWORKSLLC.com. So we just touched on this briefly a little bit earlier in the show, Selinda, but I wanted to go back and talk about this again because I think it's something that a lot of women suffer with and nobody wants to talk about it. And that is, issues with intimacy or pain during intercourse, and how pelvic floor physical therapy can actually help that. Because I was saying to you earlier, like, wow, there's a lot of connections here that I would never have made.
Right. Yes, absolutely. Yes. And that is probably one of the number one things that, people are embarrassed to talk about, or they don't want to bring up to their doctor, or, they probably wouldn't even talk about it if I didn't have it written down in my questionnaire,
Mm,
you know? So,
yeah.
but it's really important. I mean, this affects your intimacy with your partner. And so, talking about it and getting you more comfortable with it, and then obviously you need to talk about it with your partner as well, and there's lots of things we can do. So a lot of times you're having pain with intercourse from just muscle tension, difficulty relaxing, and it can be linked to the tension in the pelvic floor. So we can definitely work on that, do some manual therapies like some breathing techniques, and helping to restore blood flow, and just restoring comfort and confidence is really important.
Yeah, for sure. And I think there's a lot of women who probably avoid it because it's painful. And so the more that happens, I mean, I feel like it's compounding, right? Like if you struggle with, being relaxed or having pain or whatever, so you avoid it and then you continue to avoid it. And then that just makes the compounding the situation worse, right?
Right, right. Absolutely. Yes. And, there's lots of strategies to go about to try to make it a little better. I mean, there's different degrees, and, somebody might have pain with initial penetration, somebody might have pain with deeper penetration. Like, so it depends. And there's, things that you can use to not make the penetration as deep. So there's, and tools to help release your muscles. So there's lots of things you could do. And obviously I can, help release your muscles. I can teach you how to do it, some stretches. So there are things to be done to make it better. And it is like anything, you have to be patient. there aren't like, quick fixes.
Mhm.
It's something that's going to get better over time with working on it. And we talked earlier about homework and then doing things, yourself to try to release some muscles as well.
Yeah, it's really fascinating to me because I think everybody thinks like, oh, well, if I have pain, my only solution is like a lubricant, and half the time those like don't work, or people complain about it, or it's irritations and things like that. And I think women are like, well, the lubrications don't work, there's no other solutions, but this is actually a potential other solution that you may or may not need other assistance with.
Right, absolutely. And I agree. Like, you got to make sure that whatever you're using is like, pretty natural, water based, and it's not going to be irritating to your skin. Yeah, for sure. So, making sure you're using, products that are going to be friendly to your pH in the vagina, that's really important. How you care for the vagina, like nobody talks about this stuff.
Yeah.
But it all
Nope.
matters. It all matters, so and it all can, one thing can affect the other.
For sure, for sure. Yeah. Um, is there anything else that like you wish more women understood? Is it anything like a misconception, or I mean, related to this, related to, what we're talking about, intimacy or things like that, or just the pelvic floor health in general?
Yes, for sure. I think that one of the misconceptions is that many women have leakage and they think that it's normal. Like, it's common, but not
Hmm.
normal. So a lot of them are like, ah, yeah, I'm just getting old. I'm just going to deal with it. And I hate to say it, but a lot of providers kind of make women feel that way too. And it's not true. Like, you can get help, you can get care. Um, that's what I'm here for. I'm here to help you and let you know that, a lot of times a lot of women see improvement, within a few weeks, and it's not something you have to live with. Just be the advocate for yourself and know that if it doesn't feel right, then seek out care. And it's not normal, but it's common, very common.
I'm glad you said that because I think I've been having a lot of conversations with more, naturopathic physicians, and more of the people that are, I would say, in the natural medicine world that I'm connected to, about this whole concept of aging and what is to be, what should be expected, or what's normal
Mhm.
versus what's common but not necessarily inevitable, right? And this is just one more of those things that people think, oh, well, I'm getting older, so I'm going to have a harder time maintaining my weight, or I'm automatically going to gain weight, or I'm not going to be able to do as much physical things as I used to, whether that's, playing a sport or being active or exercise or whatever, or I'm going to have all these aches and pains. And it's so interesting because, there's a lot of books out right now on longevity and a lot of research happening. And a lot of the practitioners I talk to, more and more, saying, like you just said, these things are common, but it doesn't mean it's a fact, or it's supposed to happen, and there's, it's inevitable and it's going to happen to everybody. It's not.
Right. Right. No, definitely. And being proactive, definitely start seeking, care before it becomes a problem. Like, the best offense is a good defense, right? Like,
Mhm.
you got to start preparing your body for what, you know, it might need to endure later. Like, if you plan on, getting pregnant, you should definitely start getting some therapy now to, one, just to understand what to expect, two, just to prep the body. And I think it's like invaluable education.
Yeah, and then and you just actually identified another like, niche area, is women who are looking to conceive, young women basically.
Yeah, absolutely.
Yeah, that's for sure, for sure. One question that I know people will be curious about is, does insurance cover this typically, or is this more out of pocket?
Yes. So I am a participating provider with Anthem, Blue Cross Blue Shield, Aetna, and Cigna. And they absolutely do cover it. So we take in network and out of network benefits. We have a dedicated billing team. We make it easy on our website. You input all the information, get verified. They do all the work for you. They verify your benefits. And even if you have out of network coverage, this is pretty unique. Um, we provide the service to you of submitting those bills on your behalf. So then it starts going towards your deductible, and it takes all the work, out of it for you. So you just can relax, focus on what matters most, which is your recovery and well-being. And then we really feel at PT Works LLC that, every woman should have, effective and access to care that works.
Yeah, for sure. For sure. And even if insurance isn't covered by it, then you take patients and it's just basically out of pocket pay.
Right. Absolutely.
Okay.
So we see both, patients private pay, they can use their, HSA accounts. And we also, we try to make it, affordable, for patients as well. And also we take obviously those three major insurance plans.
Yeah. I mean, anybody who knows me in our magazines, I mean, I'm a big proponent of not relying on insurance to dictate your health care. And knowing that, listen, if you want a particular provider, or if you have an issue which traditional medical is not really helping you with, then it's, you need to take that responsibility and pay for it yourself. Honestly, I mean, it's your health. And if you don't have that, then what quality of life do you really have? So,
Right.
it's, that's my soapbox. So I'm like, yep.
Yeah,
Listen, don't complain to me that oh, insurance doesn't cover it, so I can't go get the care. Yes, you can.
absolutely. So, and we're giving you the best of both worlds. We're giving you private pay and, those three, major insurance plans.
Yeah, for sure, for sure. Well, this is awesome. I think like we've been saying, it's definitely something that women especially, need to learn more about, need to know that it's out there, that it's available to them, recognize the symptoms and things like that. And, I think just us having this conversation about it makes it more approachable for people to know, like, well, how is this going to help me? And what should I expect when I go see someone like you, Selinda?
Right. Absolutely. Yes.
Yeah,
It's
and I find, like you said, like there's not many providers. To be honest with you, I mean, I feel like I've talked about it with providers before, but I don't know that I've ever met anyone that specializes in it and that's doing what you're doing.
Oh, thanks. Yeah. I love it. So I'm happy that I'm able to do it. So it's very exciting for me.
Yeah, that's awesome. That's awesome. And you have your own private practice in Avon, and
I do.
obviously, yeah, this is. Are you able to do anything virtually?
So I am not set up for virtual at this point, but yeah, that's always a potential to do
Mhm.
like down the line. And I can see how, that could be helpful for some people. But obviously, you really do need the eval. You need your hands
Right.
on for that eval. But there's a lot of other reasons, like how you could do it virtually, like for education, different, scenarios. But definitely, I'd want to get my hands on that person and be able to really kind of assess like what's going on.
Yeah, no, no, I totally understand that. I mean, physical therapy and massage and body work and things like that, obviously, we may never be at the place where, it's completely hands off, obviously. And that's
Yeah.
the whole point of what you do, honestly, is
Right.
to be able to, treat a patient and do manipulations and things like that if you need to. So we're
Right.
going to learn more when we come back. We're going to take a quick break right now. We're talking with Dr. Selinda Shepard of myptworksllc.com. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. You can learn more about me at www.drdianehayden.com. And I'm talking today with Dr. Selinda Shepard, and her website is www.myptworksllc.com. That's spelled MYPT WORKS LLC.com. So basically, how does your company support women on their pelvic, not only on their pelvic journey, but their overall wellness journey? Selinda, what would you say about that?
So I really like that our company is taking like an integrative approach to the therapy. So, you know, pelvic floor can be influenced by like stress and movement and your overall wellness. We're trying to look at all of that. So I personally offer um, acupressure for pelvic health, yoga for pelvic pain. I also offer nutrition and supplemental support. We also have some practitioners that provide Reiki, yoga, lactation consulting. So
Wow.
we're providing a space where it's really integrative with practitioners that are here to help you, support you along your wellness journey. And, whether you're suffering from postpartum, trying to hormonal balance, we provide a supportive team to try to help you on your path to overall improve wellness and health.
That's amazing because so many times, you see a patient and you help them with one specific thing, but what they really also need are things like functional nutrition or exercise programs or
Right.
whatever it might be, or stress reduction types of things. And you don't do all those things, right? Because your specialty is PT, let's say.
Mhm.
Same thing with like a naturopath. Potentially you know that your patient really needs more whole body care, let's say, for the whole person, all of the systems in the body, not just this one that we're specifically talking about and treating. And it's great that you offer everything there because the person now doesn't have to go out and find it on their own, or you have to come up with a referral system, right? Like everybody is kind of in-house there.
Right. Yes. And actually, I told you before, I love learning. I'm always going to be a lifelong learner, but I always felt like in PT, one of the missing pieces was nutrition. So I made sure that I tried to get that piece, myself. And it is, I'm a chronic pain, it's a really long title. uh, Functional nutrition for chronic pain practitioner, meaning that we're looking at the triggers, like, of what's, contributing to your pain. And a lot of times it's nutrition, imbalances and things that, are providing inflammation in your body, stress. Like I am a big believer in breathing, just breathing. And, that can help reduce your stress level and breathing properly. It's weird to have to think about, you have to think about how to breathe, right? But
But people don't breathe, honestly. Like even myself, sometimes I feel like I all of a sudden realize, why am I holding my breath?
yes,
Like literally.
yeah. I have some
Yeah.
people, you need to count out loud. Like I can tell right now you're
Yep.
not breathing. Count out loud.
Yeah, for
So
sure.
yes.
Yeah. So that's amazing that you have all those other offerings. And one thing when I was reading your bio, I meant to ask about this oncology for pelvic health. That's interesting.
Yes. Yeah. So that is a little near and dear to my heart as my mom, um, she had endometrial cancer. And so I was like, okay, but interestingly enough, I actually worked in a cancer institute. Um, so let me tell you how helpful that was to being able to, you get a phone call that says that she needs like care ASAP. And sadly, they're like, oh yeah, we'll see you in a month. And I was
Yeah.
like, no, 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 no. I walk next door to the OBGYN gyno. I'm like, hi, this is what's going on. Can you please help? Sure enough, the next day my
Wow.
mom gets in. So connections help, right?
Hmm.
Connections help.
Yeah.
And, having good relationships within your own, departments and whatnot. So that was fantastic. So I had already, had some interest in it because obviously working in a cancer institute. So I do have that oncology for pelvic health, under my belt. And it's something that's always going to be important to me because I know how scary that was going through that with my mom and what you have to go through. I've lived it. I've been there, and I know I'm not the patient, but I know what it feels like to help support that patient. So
Right.
definitely an important piece. And to know that, they can get, care. Like you don't have to, just like anybody else, like your tissues are going to become weakened from radiation. They're going to become thin,
Mhm.
you'll have all this dryness. So interestingly enough, you have these effects from the treatments that are trying to make you better. And so, and then they become too tight from the radiation. So there's lots of different, facets that go along with the oncology.
Yeah, yeah, that's really great. Um, so are there any like client success stories that you could tell us? Anything that comes to mind of somebody you worked with who had, like a really great result or anything like
Yes.
that?
One woman in particular, because she comes in and she's like, yeah, I don't know if this is going to help me at all, but I'm here. I'm just going to, see what this is about. I'm like, okay, well, thanks for coming in. I appreciate, you seeking care. And we, talk about all the things that she's, dealing with. And for her, it's like super frustrating and annoying, which I get it. Like these symptoms are frustrating and annoying. And of course, the leakage, number one thing, like nobody wants to go around and have to worry about leakage when you're,
Mhm.
exercising, walking, or, just trying to live your everyday life. So I'm happy to say that in 5 sessions, she got great results, no more leakage, no more symptoms. And I have to say that's a record for me.
Wow, that is awesome.
Yeah, it was really rewarding for both of us. So that was great.
Yeah, it's funny how sometimes, people go into things thinking like, no, I'm going to try it, but it's not going to work.
Right, but I think mindset's very powerful.
True.
So the brain and body connection are huge. So if you think it's going to help you, it's going to help you. But if you don't think it's going to help you, it's probably not going to get as good of a result. So you definitely have to go in with open mind and just receive the information and let your body try to do the healing.
Yeah. Yeah. And it will. That's the thing,
Yeah,
right?
yeah,
Our bodies are so amazing. It's like just given the right tools, right? They're basically the best healer, in my opinion.
they're amazing, very resilient, and you just got to take care of it. You have to put in the work. Give it just like a car. Like if you give it, the 87, it's going to run okay. But if you give it
Mhm.
93, it's going to perform a lot better, right? So give it that fuel it needs to be healthy and you'll function a lot better.
Yeah. Yeah. And that's just goes to say how important nutrition is, right? And potentially
Right.
supplementation. Is there like one, if you had to pick, your favorite supplement for pelvic health, what would you pick?
Probably just like your average daily supplement, that covers all the bases, that gives you everything that you need. We actually have, so my website, there's a women's health version, which basically has it all. Has all the B12 and the zinc and the calcium. Like it has everything that you need. Plus, there's also one called Daily Essentials, which are everything that you need in your everyday function, and they actually taste pretty good. So that's the good news. They taste pretty good. Mix it with water, and you're good to go. And then you're getting a lot of vitamins all at once, and they're natural, which is super important, and the bioavailability is really high because you want something that has an increased absorption rate. You don't want something you're going to pee out like 30 minutes later and that goes, well, there
Mhm.
went $30. you know so
That's true.
you want the ones that are natural and are going to stay in your system and that are going to be good for your body.
That's awesome. And so you offer supplements as well as part
I
of
do.
like the
I do.
program.
Yep.
Yeah.
I do. Absolutely.
Yeah. That is awesome. That is so awesome. Um, and basically so what's the best way for people to get in touch with you to find you? I mean, obviously they can go to your website, myptworksllc.com. Is everything pretty much there for people to
Yeah.
be able to reach out to you?
Yes, I had this wonderful person revamp my website, and I love it. And so there's 2 pages to it. The first page is like the homepage talking about, what, we have. And the second page is all about the services, and you get more information for the services. There's a place for you to, get the contact information. And it's really cool because I get all the information, right away. I'll contact you, and I'll, thank you for reaching out. And then, especially if you fill out the insurance verification, that goes directly to the billing team. They give me all your information. I contact you, and I get in contact with you, and then we schedule appointments. Oh, the other thing is you can actually schedule online, which is very cool.
Cool.
So you can pick what you want. If you want like acupressure for pelvic health, you can pick that. If you want yoga, you can pick that. So it's super, super
That's
easy
awesome.
to get appointments. You can kind of schedule them yourself, and I'll know that you did that, and I'll get back in contact with you.
Awesome. Well, thank you so much, Selinda. This has been awesome. Great information about pelvic floor and the therapy for it and everything that you do, which is so, so needed. So thank you for that.
Of course, and thank you for having me. And for every woman out there listening, please, get the care that you need, and that you deserve comfort, confidence, and support. And at PT Works LLC, we're here to help you do that.
Awesome. Awesome. And I want to thank all of you for tuning into the show. Please join me the first and third Thursdays at 11 a.m. Eastern, 8 a.m. Pacific. I will see you back here next time.